Welcome to the presentation on anodyne therapy by Lauren Robinson. Anodyne therapy is a type of infrared light therapy system. The purpose of this system is to increase circulation in the body. Specifically, the theory behind anodyne therapy is that the use of this technology will increase circulation to treated regions of the body, and that meaning the places where the therapy pads are placed. It's a non-invasive device that has developed into a therapeutic procedure that is used in three main ways. These ways are to reduce inflammation, reduce edema, and reduce the pain associated with chronic joint disorders. Referenced by Chung, Day, Sharma, Hung, Carroll, and Hamblin in 2012. There are many infrared technologies on the market today. These technologies are referred to as infrared light, low-level light therapy, laser therapy, and anodyne therapy. The difference in these technologies are not in the name, but in their method of emission. The technologies differ in their wavelength, pulse rate, and intensity of light emission. The different emission methods will dictate how that technology works. For example, the heart tissue laser used in laser surgery operates with a wavelength of 3,000 nanometers. The type of infrared light therapy I am addressing in my presentation is anodyne light therapy. Anodyne light therapy is a system that uses a series of monochromatic LEDs and their devices to emit a wavelength of 890 nanometers of light through the skin. This emission of light through the skin prompts the body to release nitric oxide in that specific area. The increase in nitric oxide increases blood circulation in the area where the LED pad is placed. This increase in oxygenated blood to the area can decrease pain and inflammation. The model that is shown here is the 120 system from Anodyne Therapy. The cost is $950 for a new system, and that includes a 2-year warranty. The refurbished model cost $550, and it also includes a warranty, but it's not a 2-year warranty. The next model that you will see is the professional model. This model costs $5,499 new, or the refurbished price of $4,570. The warranty options are included as the same as the last model. The replacement pads, which is what you're reviewing now, costs $550 as a flat rate, but it can vary depending on if your model is 10 years or older. If your model is 10 years, they will replace the system entirely for that $550 flat rate. If it's under that, they will replace just the pads, but it depends on which pads and which model it's for. Anodyne Systems also offers lower extremity devices. I think they're more geared towards PT, so I just wanted to let you see what else they had to offer. Anodyne therapy is appropriate for clients who are diagnosed with or are experiencing weakness, numbness, and pain due to peripheral neuropathy, referenced by DeLellis, Carnegie, and Burke, 2005. Also those with loss of balance and sensation due to diabetes, referenced by Leonard, Fourcroy, and Myers in 2004. Clients with circulatory insufficiencies, referenced by Mack and Chang, 2012. Peripheral neuropathy due to diabetes, referenced by Lavery, Murdoch, Williams, and Lavery, 2008. Also by Powell, Carnegie, and Burke, 2006. Those with sensory impairments due to peripheral neuropathy, referenced by Pendergrass, Miranda, and Sanchez, 2004. Chronic back pain, referenced by Heisch and Lee, 2014. And carpal tunnel, referenced by Fusakul et al., 2014. To purchase the Anodyne system, it's funded out of pocket, especially to purchase the device. The treatments can also be funded out of pocket, but it can also be billed to insurance companies if the therapist bill it as a therapeutic exercise or as gait training. If they bill it in this manner, Medicare or other insurance companies can reimburse for the treatment. The chart displayed currently shows the recommended treatment guidelines from the Anodyne Therapy website. It gives you the treatment times, which are generally between 20 and 30 minutes, the frequency, which is 2 to 3 times per week until the condition resolves. But I have also read that treatment, if you have a home therapy system, should still continue afterwards, because once you stop the treatment, the pain or whatever the ailment is due to that condition could return. And then it also gives you the number of treatment pads that are used with these treatments. Studies have been completed on infrared light therapy and the use of the Anodyne technology to improve client outcomes. Multiple studies have been completed on the use of Anodyne therapy with diabetic peripheral neuropathy. Diabetic peripheral neuropathy is a condition that causes nerve damage due to diabetes. Diabetic peripheral neuropathy can affect the hand and feet of clients. It also creates a decrease in function due to the pain and can affect the client's balance and gait. In 2004, a study was conducted to test the use of Anodyne systems in reversing the pain and decreased sensitivity associated with diabetic peripheral neuropathy. A double-blinded protocol was used to test 27 clients. The results of the study showed that the number of desensitized sites decreased on the clients who followed the protocol of the study, referenced by Leonard, Farquhar, and Myers in 2004. As you can see on this slide, I have also included other references for diabetic peripheral neuropathy, carpal tunnel, chronic low back pain, and microcirculation. Unfortunately, I do not have all of the time I need to go into all of the evidence that has been generated with the use of anodyne therapy and these conditions. So I have compiled a handout that will give you more information, and you can look there to see all of the uses of anodyne therapy with these conditions. Overall, I believe anodyne therapy is a great up and coming technology that can benefit the field of occupational therapy, because an occupational therapist can use anodyne therapy before or after an activity is performed during a treatment session. For example, if an occupational therapist has a client who has a contraction of the shoulder and cannot complete her job because of her limited range of motion, the occupational therapist can perform anodyne therapy along with completing range of motion exercises. According to Santamato et al., 2009, this may assist in reducing inflammation and increase the range that the client is able to perform. So doing this will allow her to return to activities of daily living, which is the ultimate goal. I hope you all have enjoyed listening to this information about anodyne therapy. Here are the references that I've used in my research. Please don't forget to view the handout along with the pamphlet that I've provided. If you have any questions, please let me know, and thank you for watching.